and Tanzania. Dr. Parchani has been a speaker of various international conferences and has collaborated with the health organizations to enhance medical education and healthcare delivery. Last year, he was selected as a top young scientist from India and attended the Lindau Nobel Laureates meeting. Thank you, Dr. Ashwin, for coming personally from India. A big effort. Thank you very much for your support.
Thank you for the kind introduction, sir. Imagine a world where every community, no matter how remote, had access to quality healthcare. A world where the skills and knowledge of every medical professional was available all across the globe, and they were able to bring hope and healing to the communities who most need it. Namaste. Ladies and gentlemen, esteemed faculty of the Academy, and my fellow young scientists. Today I am honored to be here and share my journey in medical volunteering with you all and its impact on the global health. My discussion today will explore the current pressing global health concerns, the role of medical volunteering as a potential solution, my journey in medical volunteering and its impact on global health, and finally, I'll share an inspiring story of hope and determination which has impacted several lives in a town of East Africa. To understand the importance of medical volunteering, we first need to grasp the current global health landscape. Health inequity is a major concern. The World Health Organization utilizes the Service Coverage Index to assess the universal health coverage across the globe. As you can see here, the regions highlighted in yellow and orange are the ones with poor health coverage. Significant challenge predominantly present in the global south. This disparity is largely due to the severe shortage of medical professionals in low and low middle income nations, as illustrated by this graph. Over the past decade, these countries have seen little to no increase in the number of medical doctors relative to their population. And this contrast is striking. While high income countries boast 37 doctors for every 10,000 people, there's barely one doctor per 10,000 people in low income countries. This stark difference highlights the critical need for targeted interventions and the vital role of medical volunteers to address this gap. Let's turn our attention to the disease burden in the global south, where there's a high prevalence of infectious diseases such as HIV, TB, and vector borne diseases like malaria. Take TB for example. There are certain nations in Africa and Southeast Asia where the incidence of tuberculosis is more than 500 individuals every 100,000 population every year. To address these concerns, we need adequate and appropriate healthcare infrastructure. But do we have that? The answer is no. Let's look at this illustration. You can see that low-income nations allocate just a little over 6% of their global budget, of their government budget to healthcare. In a stark contrast, the upper middle and high-income countries, which are represented by the yellow and the green lines on top, spend over 12 and 15% respectively, and these numbers are ever increasing for the past decade. This disparity in healthcare investment further exacerbates the challenge faced by these low income countries and highlights the need for increased support and resources. In the face of such daunting disparities, there is a beacon of hope, and that is medical volunteering. This is a process which involves dedicated individuals from the field of medicine, such as doctors, nurses, allied healthcare specialists, such as physiotherapists, who selflessly offer their skills, time, and knowledge and make an everlasting impact to the community that they serve. They not only provide essential services, but also mentor and train local healthcare workers. Training ensures that the positive effects continue long after the volunteers have left. Volunteers help create an international network of leaders committed to driving change and promoting global health. Let's talk about my journey. So my journey began in 2014 when I was a first year medical student and I volunteered in Uganda, Africa. I was working in a level 4 healthcare center in a small town of Mukono. And this center provided basic OPD facilities, maternity and child health facilities, and general surgery services for elective and emergency C-section. This journey had a profound impact on me and changed my perspective on healthcare, and later inspired me to continue my volunteering journey in the year 2016 when I visited Philippines. In Philippines, I was working at a memorial hospital in the district of Kalinan, just outside of Davao City, and here I was working in the Department of Internal Medicine. These experiences have always inspired me, and therefore, after completing my residency and earning my specialization, this year I went to Tanzania, Africa, and this time as a physician. I was working in two teaching hospitals for a period of 8 weeks, initially in Arusha and later on in the beautiful island of Zanzibar. Now let's now let's delve deeper into the tangible effects of medical volunteering. Addressing the shortage of healthcare workers is a crucial contribution by volunteering. During my time in Uganda, I encountered a stark reality. The lab only operated with one technician, and that technician was responsible for sample collection, sample processing, as well as testing. He had a backlog of 36-hour backlog with the existing backlog as well. I entered into the picture to alleviate this critical issue. I stepped to assist him in processing and testing, and through collaborative efforts, within a week, we brought down the reporting time to a mere 8 hours. Implementing task shifting and sharing responsibilities with local healthcare workers doesn't only address immediate gaps, but it also fosters long term capacity building. Volunteering also plays an important role in training and mentorship. By training local healthcare workers and sharing our knowledge through ward rounds, seminars, as well as remote education, we help build a competent and capable workforce. During my time there, I helped students organize a few seminars, and I even started an online community where I used to share important medical resources with the students there. During my experience, I even identified a crucial gap in life support training among the interns and registrars in the hospital. Being an AHA certified instructor for life support myself, I took on the responsibility and took the initiative to impart comprehensive training as a part of the teaching that I was providing there. Although the resources were limited, I was able to empower the interns and registrars to confidently handle cardiac emergencies. It is important to understand that only through capacity building we can create a long lasting impact. During pandemics, medical volunteers emerge as invaluable assets. The year 2020 was a difficult year for all of us. The entire world came to a standstill. Healthcare systems were overwhelmed, and healthcare workers were tirelessly working day and night to provide services to patients. I myself was in the COVID ICU for 18 months during the pandemic. And it is important to realize that volunteers stepped up during that time and helped in augmentation of the healthcare workforce. They also provided logistical support on ground and also helped in campaigns, organizing vaccination drives, conducting contract tracing, as well as assisting in research and providing telehealth services to those who could not access healthcare physically. In India, a significant milestone was achieved with the vaccination of 1 billion people, which was made possible through the dedication of volunteers who stepped forward during these uncertain times. Across the globe, volunteers united to support healthcare systems during these uncertain times. It was truly a testament to the vital role that volunteers play in strengthening healthcare responses during time of crisis. Volunteers also contribute to healthcare leadership and policy making. Volunteers gain insight into local needs, enabling them to advocate for evidence based policies that address specific community challenges. By managing teams and understanding the global health perspectives, volunteers translate their experiences into actionable strategies that later on influence healthcare practices and policies worldwide. While, while volunteering, we immerse ourselves in diverse cultures and foster a sense of mutual understanding and respect. During my time in these three countries, I made a lot of friends, and I am culturally richer right now. And if you look at these three photos, There are six different individuals from five different religious backgrounds and four different continents. This proves that volunteering transcends boundaries, unites people across cultures, and exemplifies the collective strength in addressing global health challenges. Volunteers also bring a fresh perspective and innovative solutions to the challenges that they encounter, driving positive change. By empowering future leaders and volunteers, fostering a culture of growth and learning, and providing mentorship and guidance, volunteers create a sustainable impact to the society that they serve. Finally, before ending my presentation, I would like to share an inspiring story of a leader who has brought about change by building it. Meet Mark Matolo. Mark is a 28-year-old architect residing in Arusha, Tanzania. Dissatisfied with the basic facilities available for the population, he saw the potential for architecture to transform communities. He started the Caribou Foundation. Through his foundation, he has spearheaded projects that address critical needs of the society. He has utilized volunteers to build daycares, orphanages, healthcare facilities, as well as sewage systems to ensure access to clean, safe water and proper waste disposal for the local community. These are the dormitories constructed under his supervision. What really motivated me today to share Mark's story is this. Growing up, he was not very happy with the education system. So he thought, why not build a school? There are over 100 kids in his school, and the school curriculum is in English to help these kids access more opportunities later on. Teaching is via the mode of electronic tablets and computers. And if this was not all, Mark also made sure the kids are provided healthy meals in school. His organization also takes care of disabled kids by providing them access to proper health via means of therapy and other specialists. Apart from his tie-ups with the local teaching hospital, he has also been proactive in organizing school health checkups and camps in nearby villages. This is a photo of one of the camps that he organized to screen for non-communicable diseases, in which the patient turnout was 150 people. He has truly created a space where volunteers can thrive and make a meaningful impact. His innovative approach to volunteering serves as a model for global community development. At the mere age of 28, Mark has single handedly addressed the issues of nutrition, healthcare, shelter, water, and education in his community. Not all heroes wear capes, but Mark is truly an architect of change. We need more leaders like him to guide the communities worldwide. Finally, I would like to end my presentation with this beautiful quote from Mahatma Gandhi. The best way to find yourself is to lose yourself at the service of others. I would like to thank the Academy for welcoming me here today. It has truly been a pleasure. Muito obrigado.